So, hello again, welcome back to Exploring Lifestyles and Legacies. Again, I'm joined by Dr. Maluleke. And today, we're going to be talking about why some doctors are more stressed than other doctors. So, let's go to yourself.
Now you are stressing me, Kelvin.
Okay.
Thank you for having me. And it is one of those things we should all know that doctors are not immune to healthcare issues and mental health issues.
People too, yeah?
Yeah, we are also people and we go through all these things. So a recent publication in Medscape showed that there's a sharp contrast on the perception and of how doctors agree whether they are stressed or they're depressed or not.
Mm-hmm.
And French doctors seem to report lower burnout, while Brazilian doctors reported much higher levels of burnout. The reasons go beyond just the amount of patients they see too. It's also to do with culture, policy, and workloads that shape their stress.
Okay.
Yeah.
So, would you say then that culture plays a significant role in this? Like how?
Yes. In France, for example, burnout is seen to be a sign of weakness, but it's less stigmatized than depression. So doctors may admit somehow to some level of burnout, but they will absolutely underreport depression. And measurement and stigma shape the data that we see. Okay? Yeah.
So, looking at the report here, Brazil seems to stand out in the report.
Yeah.
Do you have any idea what's happening there, or?
Yes, Kelvin. Brazil expanded their medical schools,
Mm-hmm.
but the residence slots, that is where soon after you graduate, you have to go and do residence, where you are now training for your specialty.
Okay.
They didn't keep up the amount of doctors that they're churning out of the medical schools with the residence slots.
Okay.
So jobs are clustered in cities, and rural areas lack doctors, and younger physicians tend to face long hours, debt, and job insecurity, because basically they're chasing few jobs.
Okay.
Yeah, they've got too many people chasing fewer jobs.
So, in that sense, are you saying that work life for a doctor is actually very important, and as well as that work-life balance and vacations and having a nice healthy balance between yourself and your occupation, is that important?
Yes, that is very, very important. Work-life balance. You see that in the European Union, the vacation days are guaranteed, whereas, for example, in the United States, there are no federal paid leave requirements for your employer. So it's up to, from one employer to the next, it's up to their own discretion to say we are going to have annual leave or not. Yeah. So more time off correlates to better well-being for doctors. And they, in Europe, doctors seem to be more protected than elsewhere.
Yeah. So, outside, I guess, including Europe, but mostly then outside, going off what you're saying, are you saying that administrative burdens are a factor in stress?
Absolutely.
Okay.
Doctors often spend more than 5 hours daily on paperwork, and electronic health records in addition to patient care.
Mm-hmm.
This is into their evenings, their weekends, their family time, and hopefully advances in AI might be able to assist in partly in this, because otherwise it takes quite a lot of time,
Yeah, of course.
Yeah, updating records and things like that.
So, what solutions are there actually to help doctors reduce stress in their workplace?
Like I was talking about, AI, smarter tech is quite good, so that some of those admin issues can be taken over by artificial intelligence. Fair staffing levels are also good, because we are saying when people are understaffed, then you have too much work to do.
Okay.
And real recovery time like vacations, allocating to your employees enough time for them to rest as well is good. And a culture shift might also help so that we all value mental health.
Yeah, of course.
Yeah.
So, going back to what you said earlier with the
Yeah.
statistics of Brazil and France, you're saying that doctors aren't equally burned out worldwide. So
Yeah.
does that mean that the problem can be resolved equally, or does every country kind of have to handle it in their own way?
If we, the ideal situation, we don't always get it. But if we had to get the ideal situation, this could be a worldwide thing. Maybe the WHO giving some guidelines and countries having to adopt those guidelines. Yeah.
And this would have positive, like, kind of an outcome on the
Yeah,
doctors and the
certainly. If
patients.
your doctor is healthier, then they look after their patients
Well,
in a more they'll do a better job in it.
Yeah. Okay.
Yeah.
Well, coming to a close on this then, any final messages you want to give to your viewers on this topic?
Yeah. My viewers, please know that doctors are human. Their stress is systemic. It's to do with the system, not personal weaknesses. Yeah. When we protect our doctors, in turn we protect our patient care.
Yeah.
So please subscribe, comment, and remember, this is for educational, not medical advice. We'll see you next time.
Yep. Do your research on this topic. If this affects you or someone you know, let them know. Maybe show them this video or seek some help elsewhere. It's always good to get as much help as possible. And yeah, thanks for watching.
Thank you, Kelvin, for protecting your doctors.
Yes. Alright.